Hello, and welcome to Let's Talk, a Tulsa World virtual town hall meeting. I'm Wayne Green, editorial pages editor of the Tulsa World. Today's town hall is graciously underwritten by the George Kaiser Family Foundation. Today we're going to be doing something a little bit different. Our town hall will feature a debate of State Question 802, featuring two leading state policy advocates. Arguing for State Question 802 will be David Blatt, who teaches public policy in the Master of Public Administration program at the University of Oklahoma, Tulsa. Arguing against State Question 802 will be Jonathan Small, president of the Oklahoma Council of Public Affairs. Gentlemen, welcome.
Thank you.
Thank you.
Also joining us today is our timer, Patty Mullen, a member of the League of Women Voters of Metropolitan Tulsa Board of Directors. We'll be using a modified version of the debate format commonly used by the League. We've solicited questions for today's event from Tulsa World readers. I'm the only person who's seen these questions that we'll be using today. Once we begin, I'll ask a question of either Mr. Blatt or Mr. Small initially, and he will be given up to 3 minutes to answer. The opposing debater will then be given 2 minutes to respond. A few seconds before the timeout runs out, Patty Mullen will hold up a yellow card that debaters will be able to see on Zoom, and if they run out of time, she will hold up a red card. Gentlemen, if you see the red card, stop. I will allow you to complete a sentence perhaps, but I can mute your microphone if it comes down to it. Before we begin, here are a few background facts on State Question 802. Its topic is Medicaid expansion. Medicaid is a government-funded healthcare program. In Oklahoma, Medicaid is available to people in certain groups who meet income eligibility: the elderly, children, and pregnant women. Working age adults are generally not eligible. Medicaid expansion was authorized by the Patient Protection and Affordable Care Act, signed into law in 2010. It would add income eligible working age adults to those who are eligible for Medicaid. Medicaid is paid for with a mix of state and federal funding. Currently, the federal government pays 90% of the cost of people who become eligible as a result of Medicaid expansion. The state is responsible for the other 10%. Initially, Medicaid expansion was a mandated part of the Affordable Care Act, but in 2012, the U.S. Supreme Court decision that found the Affordable Care Act constitutional required that Medicaid expansion be voluntary for each state. 36 states in the District of Columbia have accepted Medicaid expansion. Oklahoma has not. Last year, Yes on SQ 802, Oklahomans Decide Healthcare, mounted a petition drive to revise the state constitution and require Medicaid expansion. That effort eventually gathered nearly 178,000 signatures, enough to put the issue on a statewide ballot. The question will be decided by the voters of Oklahoma in the June 30 election. Any registered voter can take part in the election. If the measure passes, Medicaid expansion will begin no later than July 1st, 2021. The ballot title reads, "This measure adds a new article to the Oklahoma Constitution. The new article would expand Oklahoma's Medicaid program to include certain low-income adults between the ages of 18 and 65 whose income does not exceed 133% of the federal poverty level, as permitted under the federal Medicaid laws. Shall the proposal be approved?" To begin today's debate, I'm going to give each of you 3 minutes to make an opening statement. Before we began, Patty Mullen flipped a coin and David Blatt will speak first. So David Blatt, your time begins now.
My thanks to Wayne and to the Tulsa World for inviting me to be part of this important debate, and to my friend Jonathan Small for agreeing to participate. I want to use my introductory statement to lay out 3 reasons why Medicaid expansion is good for Oklahoma. It is good for our economy, good for our rural hospitals and community, and good for the 200,000 Oklahomans who gain health coverage. The first reason is economic. For every dollar Oklahoma pays to provide health care to someone who becomes newly eligible for Medicaid, the state will receive $9 back from the federal government. This means that we can bring home over $1 billion a year in Oklahomans' taxpayer dollars that otherwise goes to fund health care for Californians, New Yorkers, New Mexicans. Due to a decade of stubbornness and inaction from political leaders in Oklahoma City, we've been leaving over $1 billion a year on the table. It could be critical healthcare jobs and generate more tax dollars here in Oklahoma. The second main reason to support Medicaid expansion is that it extends a lifeline to our rural hospitals and communities. There's a sign that hangs near the entrance of Fairfax Community Hospital in Osage County that reads, "A small community is only as healthy as its hospital." By that measure, we must acknowledge that many of our communities are on life support. Since 2011, at least 5 hospitals in rural Oklahoma have closed, while 7 others, including Fairfax Community Hospital, have filed for bankruptcy. We know that a hospital closing has a domino effect on a community's economy. When a hospital closes, healthcare professionals leave, pharmacies can't stay open, nursing homes have to close. For rural residents, being close to a hospital means the difference between life and death in an emergency. Only 14 states have still failed to expand Medicaid. Yet these states account for 77 of the 106 hospital closures across the U.S. this decade. Expanding Medicaid won't solve all the challenges facing our rural healthcare systems, but it will help give them a fighting chance. Finally, and perhaps most importantly, Medicaid expansion will mean that some 200,000 low-income Oklahomans will gain health insurance. These are many of the same hardworking women and men we have come to celebrate as essential these past months. Nursing home workers, home health aides, grocery store clerks, and processing plant workers, some of whom work 2 jobs and don't earn enough to afford health insurance. By expanding Medicaid, we will allow them to see a doctor when they get sick, or fill a needed prescription, or receive regular treatment for chronic health conditions. When employees can see a doctor and get the ongoing care they need, it means fewer days off work due to illness, better productivity, and less employee turnover. For all these reasons, we urge all Oklahomans to vote yes on State Question 802 on June 30th.
Mr. Small, you have 3 minutes.
Thank you so much, Wayne, and I agree with my good friend David Blatt. Thank you so much for the Tulsa World and the Kaiser Family Foundation for hosting this event today. Although David Blatt and I disagree today, we definitely agree on other issues like criminal justice reform. So maybe we'll get to talk about that in the future. Regarding Medicaid expansion, let me start off by saying that at the Oklahoma Council of Public Affairs, we really believe that Oklahoma should work to create a place where all Oklahomans can thrive, especially the most vulnerable. And we recognize that healthcare is broken, both in Oklahoma and the United States of America. And one of the fundamental reasons that it is broken is that every time there has been a challenge in healthcare, politicians convince Oklahomans and Americans that the solution is reverting to the very same government that created those challenges. Regarding State Question 802 and the specifics of Medicaid expansion, unfortunately, Medicaid expansion has proven to be massively costly for states. When you look at the states that have expanded Medicaid and kept track of the record of costs, in those states, their costs have exceeded their estimates by 157%, meaning those constituents had to deal with shortchanging of other government services and tax increases. One of the major challenges for Oklahoma is that according to the Oklahoma Healthcare Authority, up to 628,000 Oklahomans would be newly eligible for this medical welfare entitlement program. 10% of those costs is $374 million. Proponents of State Question 802 promise us that Oklahoma is going to do something that the vast majority of other states haven't done in expanding Medicaid, which is it's going to meet its estimates and that more people aren't going to enroll than what were estimated, even though across the country 157% more are enrolling. Oklahomans know that the state of Oklahoma is in dire straits as it relates to revenue right now because working Oklahoma families are in dire straits. So what are the solutions that we should look to as opposed to the brokenness of Medicaid expansion? We need to reform a current program to rededicate more than $110 million to rural healthcare. We need to empower patients so they can actually understand their bills and not have costs forced against them by hospitals. And finally, we need to innovate the state's Medicaid program so that we provide higher reimbursement rates to rural doctors and rural hospitals. There's a better way than State Question 802.
Thank you. Let's go to our first question, and by agreement, the first question would go to you, Mr. Small. This comes from one of our readers. It's quite simple. Can Oklahoma afford Medicaid expansion? The reader wrote, "Of course, I feel sorry for the truly poor and small town hospitals. But if our school budgets are reduced anymore, businesses will not be coming to Oklahoma. We are in a state mess." You have 3 minutes, Mr. Small.
Thank you so much. The listener asked a great question. Oklahoma flat out cannot afford Medicaid expansion, as evidenced by the legislature could not come to an agreement on a revenue source. A number of states have tacked on extra healthcare costs in order to expand Medicaid by charging provider taxes on the constituents and hospitals in other states. That measure fell short of fully funding Medicaid expansion in Oklahoma, which is why the governor vetoed it. As you know, the legislature faced a $1.3 billion shortfall due to the downturn in the economy. We know that thousands of Oklahomans have lost their jobs, not just from COVID-19 effects, but also from the significant downturn in the oil and gas industry. Fortunately for Oklahomans, there's still a way to help rural healthcare without having to fall into the trap of Medicaid expansion and putting in place a measure that endangers working Oklahoma families. 628,000 Oklahomans will be eligible, particularly with the new concentrated effects of both economic downturns related to oil and gas and also to COVID-19. The average cost is $5,800 per person, which states are seeing. So the potential liability that taxpayers will have is 10% of that, which is right at $374 million in state taxpayer dollars that we cannot afford. We can't trust agencies' promises that Oklahoma is going to somehow reverse history and do much better at guessing the cost of a free healthcare entitlement program. But what we can do is look at the current places where Oklahoma is not spending money properly. I know that the residents of Northeast Oklahoma know nothing about the Oklahoma City Boathouse, which receives subsidies from state government's TSET program to promote health. You see, they determined that it's better to give subsidies for a rowing facility in Oklahoma City than to give that equal amount of $750,000 additional to recruit rural doctors and help cover losses at rural hospitals. If we reform the state's TSET program, it has $110 million annually that could be rededicated to improving the life of rural Oklahomans, increasing access to physicians and health coaches, and focusing on the major detractors of health outcomes in Oklahoma. So the answer is no, Oklahoma cannot afford Obamacare's Medicaid expansion, and neither can future generations or the federal government, which is broke today.
Mr. Blatt, you have 2 minutes to respond.
Your reader asks a good question, and the reality is that Oklahoma can't afford to not expand Medicaid. We're talking about the best deal that has been offered to the state in decades. This is $9 of federal funds for $1 that the state puts up. We would never imagine turning down a 9-to-1 federal match for our roads and bridges, for emergency preparedness, for economic development. When we've looked at other states, most studies have found that the net effect of Medicaid expansion is state savings. There's one study that was just published in the New England Journal of Medicine said that with Medicaid expansion, states have seen 24% higher growth in total Medicaid expenditures, but this increase in Medicaid spending was subsidized entirely by increased federal funding in expansion states with no significant changes in spending for state revenues subsidized entirely by increased expansion. That is because Medicaid expansion gives us the opportunity to shift costs that are currently being funded with 100% state dollars for citizens in the mental health system, in our penitentiaries, in public health. We will now get a 9-to-1 federal match. Now, despite that, the legislature this past session, looking at Medicaid expansion, did come up with an estimate of $150 million, not $300 million plus that Jonathan falsely discusses. They did come up with a funding plan that passed with a majority of the legislature, and that the governor, for reasons of his own making that have not been explained, decided to veto that. So there are funding options out there, but overall what we can expect is this will be a net boon to our state's economy and to our state's state fiscal revenues.
Okay, our next question goes to you, Mr. Blatt, and it comes from a Tulsa reader. The question is, who pays for the care of uninsured patients in Oklahoma hospitals while we have refused Medicaid expansion? Is there cost shifting that causes the health insurance premiums of insured patients to rise?
That's a great question. We're all paying for this. The hospitals and other providers, but primarily hospitals, deal with over $500 million a year in uncompensated care. And that uncompensated money, they have to get the reimbursement somewhere. So that gets shifted into what gets charged for patients with private insurance, and in many cases leaves those without insurance with large and catastrophic bills, many of which never get paid, but we know that healthcare bills, particularly for the uninsured, is a major cost of bankruptcy. So we are all paying for this one way or another. The question is, do we want to continue seeing Oklahomans pay for that full cost of uncompensated care for the hundreds of thousands of Oklahomans who lack health insurance? Or do we want to take this unprecedented offer of 9-to-1 federal match to help pay for those costs?
All right, Mr. Small, you have 2 minutes to respond.
Thank you so much. Listener asked a great question. This question is part of the reason why OCPA feels that Medicaid expansion is the wrong answer. The concept of uncompensated care, frankly, is an insult to both the patients, consumers, and insurance payers of healthcare in the United States of America. In short, how the term uncompensated care is derived, hospitals create a price on what's known as a charge master that the consumer has no access to. It's an overinflated price that no one would ever pay for things like a bottle of Tylenol. Then, when low-income patients have no insurance, or private pay patients who have no insurance pay for a procedure, or when government related payers for employees such as Medicaid or state government pay, the difference between that overcharge and the actual money that's paid is called uncompensated care. We know that the concept of uncompensated care is a farce because of the significant expansion of medical facilities in our urban areas in Oklahoma. In fact, the largest hospital with surpluses well over $100 million in Northeast Oklahoma has had the dubious distinction of actually pursuing in court patients who could not pay those overcharge bills. Hospitals enter into an agreement with a local community where they're going to provide benefit. So, of course, a nonprofit is going to provide benefit in which every dollar is not paid. Medicaid expansion is the wrong way for Oklahoma.
Our next question goes to you, Mr. Small. Is there any danger that the federal government will renege on the current 90-10 funding match that pays for Medicaid expansion?
Thank you so much, Wayne. So it's really important to, in order to answer that question, to look at the facts. State Question 802 enshrines in the Constitution a right to medical welfare for able-bodied adults. Yet, the elderly, aged, blind, disabled, women, and children would have no such right, which typically they have been the first in line, and particularly those on the disabilities list, which now exceed 5,000. What's fascinating is, let's assume the federal government is always going to keep its promises. We know that it has failed to do that in the past. Thus far, the federal government has not failed to keep its Medicaid reimbursement rate promises, but there are a host of other examples where the federal government has enticed states to expand some program and not met that need, such as the IDA, Disabilities Act with Education, wherein they promised to give states surplus or nearly 40% matching and never really equated more than to 20%. But what's most important to think about that is we're on the hook for 10% of whatever the costs are. And what have we found in other states? If you take California, Arizona, Colorado, what did they find? The promises from hospitals that if you give us money to expand, it will lower uncompensated care did not bear true. In fact, what they found is that those same hospitals continued to raise prices on other consumers. The reality is, whenever hospitals, much like higher education universities, get more money, they continue to raise prices on patients, consumers, or customers, or students. So believing whether or not the promise that the feds will always keep it 90-10, we do know that President Barack Obama proposed in his budget not long after Obamacare passed, reducing the Medicaid reimbursement rate to deal with the deficit. The reality is, whatever the 10% number is that we would be obligating ourselves to, we can't afford it. Even if the federal government keeps its promises at 90-10 for the rest of our lives, we cannot afford the obligation that it forces the state to pay. The legislature proved that they could not fund it this year because the provider tax was not enough. They required the state to dip into one-time savings for the other portion of the Medicaid expansion costs. Dipping into savings for savings for ongoing expenses is not wise. It's DC style politics, and we should avoid further entangling ourselves with the federal government.
David Blatt, you have 2 minutes to respond.
Sure. We know that Medicaid is a long-standing federal-state partnership. The program was enacted in 1965 and has now been in existence for over 50 years. And during that entire period, not once has the federal government reneged on that commitment to fund the federal share, the amount that was promised. We have seen changes in the federal share. It has only and always been to increase the federal share, often on a temporary basis, as we're currently seeing in the midst of the coronavirus epidemic. So I think that we can safely say that this is a strong federal commitment. What we know is that 37 states have already accepted Medicaid, and not a single one of those states has decided to expand Medicaid, whether under Democratic governors or Republican governors under Democratic legislatures or Republican governors, not one of those 37 states has gone back to rescind that expansion. Jonathan keeps talking about some numbers, I believe from the Foundation for Government Accountability, that Medicaid costs are exceeding projections by 150%. One study that came out this past year looks at reports from Indiana, North Dakota, Iowa. Officials and agencies from all of these red states have flatly stated and documented that expansion enrollment or overall enrollment has either fallen short of or not substantially exceeded expectations. So we have a pretty good idea of how many Oklahomans are going to enroll. It is likely somewhere between 150 and 200,000. We may see some increase in that number because of our current economic circumstances, but to throw out numbers like 500,000, 600,000, and throw out this is going to cost the state $300 million, these are just flatly wrong.
All right, our next question goes to you, Mr. Blatt. Why can't people who don't have insurance but want insurance just go get a job and get insurance?
Well, the problem is most of the population that would be newly eligible for Medicaid currently are employed. Study we put out at Oklahoma Policy Institute when I was there several years ago showed that there were about 140,000 individuals in Oklahoma who are currently, who would become eligible for Medicaid, who are currently uninsured and are working. And they're working in kind of industries that simply don't provide health insurance to their workers, or workers not eligible or can't afford to get it. These are folks who may be working for a minimum wage or $8 or $9 or $10 an hour. The reality is the employer-sponsored health insurance system works very well for middle class and middle income and high income individuals. It works very poorly for low income individuals. What we've seen is so many of these industries, so many of these workers who in recent months we've come to recognize as critical workers, in working in home health services, working in long-term care facilities, in childcare centers, in convenience stores, stocking the shelves in grocery stores, small restaurants. These folks don't have insurance, so they're working hard. Their income doesn't qualify them for the subsidies under the exchange. So this is a population that private insurance market just isn't working for, and that is why under the Affordable Care Act, Medicaid was expanded for populations up to 1 1/3 times the poverty rate.
Mr. Small, you get 2 minutes to respond.
I think it's very important to note that of the 628,000 Oklahomans who would be newly eligible for this medical welfare entitlement program, 60% of those individuals already have private health insurance coverage options, either through the exchange, the famous Insure Oklahoma program, or through their current private employer. What's important to note is that what's really happened with healthcare in the United States of America is that a complicated scheme that throws in a third-party payer in between a doctor and a patient is what's driven up costs every day. The real reason why healthcare is unaffordable is because the federal government at all levels, state, local, and the federal government, have helped participate in making healthcare more bureaucratic and less transparent. The question that we must ask as Oklahomans and Americans is simple. Why is it that routine procedures we cannot get an accurate cost? And then furthermore, when we cannot get an accurate cost, when providers refuse to tell us the cost of a routine procedure, like my wife who's having difficulty getting the actual cost of a routine blood procedure for the next child that we're expecting. Can't get it because both the provider system and the insurance company are working to keep that information from us. That's the real problem with healthcare. That's what needs to be addressed. And that's what will make sure that people really have access to the care they need it. And then other options like catastrophic coverage can be made available. If 140,000 is all that's going to enroll, cap the program. But the proponents of State Question 802 refuse to do that.
Okay, our next question goes to you again, Mr. Small. If we offer free healthcare to people, what incentive do they have to ever pay for their own healthcare?
That's a great question. So I think that anyone that would try to say everyone who may be offered free healthcare won't work is not being accurate. I also think people that try to say offering free healthcare won't be a disincentive to some to work and pay for it are not being accurate as well. A huge problem with government payer healthcare, and this comes from Jay Johnson, who in a legislative committee testified that, and I quote, "We lose money on the major government payers like Medicare and Medicaid." So when you expand medical welfare, you actually create a larger pool of people who don't pay enough for their health care. And so the question is, how do we design a healthcare system in a manner in which it addresses health outcomes, it empowers patients to have more information about the costs, and it also provides a stopgap for major medical procedures, which often anything over $1,000 to $2,000 is going to be debilitating to anyone, and even lower. You do that not by engaging in more federal bureaucratic programs. I know that Mr. Blatt noted that 3 states now state that now their enrollees have stabilized. But those same states reported that starting outwards in the beginning, they had significant costs exceeding their estimates. But the way to empower patients is through a combination of programs like the Insure Oklahoma program, which Medicaid expansion requires us to gut. The Insure Oklahoma program is famous because it shared in the cost of healthcare by having people pay 15% of their costs, and then the state and the federal government covered the rest. Those kinds of programs which encourage and incentivize work, and then also efforts to protect all Oklahomans from the price gouging that is currently going on in our healthcare system, wherein we cannot get routine prices. What's important to note about states that have expanded Medicaid is that they are reporting, not independent think tanks like the Oklahoma Policy Institute or the Oklahoma Council of Public Affairs, but they're reporting that what's happening is as they are expanding Medicaid, hospitals are taking those dollars and still raising prices on consumers, even after they argued that expanding insurance coverage was going to lower uncompensated care and lower costs for patients. We just can't trust the promises of a failed government program that's resulting in price increases for all of us.
My apologies on you there for a second, Jonathan. David Blatt, you have 2 minutes to respond.
Can you repeat the question?
Sure. If we give people free healthcare, what incentive do they have to pay for their own healthcare?
Well, we know that most people who get health insurance are working and continue to work. There was a study, an exhaustive study done by the Kasich administration in Ohio, which found that people who were not working when they got Medicaid through expansion said Medicaid made it easier for them to find work. People who were already working said that expansion made it easier to remain employed. That's because of the link between being good health and being able to continue to work. So in fact, if you give people or allow people to access healthcare, you make it easier for them to continue in jobs without having to worry about how to pay for healthcare, and where every minor healthcare issue can escalate out of control. Jonathan mentioned that the options that the people currently have through their employer or other programs, I don't know then how he explains that there are 600,000 people who are uninsured in Oklahoma, and that Oklahoma has the second highest rate of uninsured in the country. All the states with the highest uninsured rates are states that have refused to expand Medicaid, and overwhelming evidence shows that when we have expanded Medicaid, or states that have expanded Medicaid have seen significant decreases in their uninsured. Now, it's not going to cover everybody. There are still populations, there are still many people who will make too much to qualify for Medicaid, or children who are currently uninsured may remain uninsured. So we're not going to suggest that with Medicaid expansion, everybody will be covered. It makes a significant dent in a way that a program like Insure Oklahoma, which only has a 70-30 federal state match, is unable to do. Insure Oklahoma at its height never insured more than 30,000 people.
Gentlemen, this has been a fascinating experience. I've really enjoyed it, and so I'm sad to say that this is going to be our last question. It goes to you, David Blatt. The question is, and I'll admit, this didn't come from a reader, wrote it myself, but I'm just fascinated with this topic. How do you expect the COVID-19 pandemic to affect the outcome of the election on June 30th?
That's a interesting question. I'm sure one that the campaign directors for Yes on State Question 802 and No are grappling with. We know that there is a surge in absentee ballots that have been requested, and I would imagine that both campaigns are strongly urging their supporters to request absentee ballots and get those filled out. And you can do that until June 23rd. This election only. You don't need a notary, although you can, but you can also attach a copy of an official state or federal identification or tribal identification. So we will definitely see a big increase in absentee ballots compared to normal elections. Now, who actually goes out to the polls is going to be, something that is really hard to predict. I think much of the passion on this issue that we've seen, for 300,000 Oklahomans who signed the petition to get State Question 802 on the ballot, which was a record show of support. I think it's fair to say that the passion has mostly been from supporters of 802. I expect that they will have an incentive to go vote. At the same time, if you look at, this is a primary election. There are not a lot of candidates running for the legislature this year, so there won't be a lot of contested legislative primaries. And most of the places where there are legislative primaries are Republican primaries. So I think that supporters of 802 as well as opponents are going to have to be very creative, make sure that their voters do go to the polls. But for all kinds of reasons, this is unprecedented and unfamiliar territory.
Jonathan Small, you have 2 minutes.
I do think it is important to know what Mr. Blatt mentioned, which is that with the very extensive and very friendly absentee ballot process, and the fact that when you think about it, voting is one of the most crucial things that we get to do in our republic. Voting is just as important as going to the grocery store to get your food, going to run an errand for your job. It's just as important as some of the most crucial things that people are able to do right now during COVID-19. So I think it's very important that no one criticize and try to delegitimize the results of State Question 802 when it passes in June 30th. Everyone has an opportunity with the absentee ballot process, and then those who want to venture out to vote in person, just like they've been venturing out to do other things, including rightfully protesting the challenges of excessive use of force by some in law enforcement. I feel like that we should not disparage that turnout. I think if people decide that they're going to vote in an undercounted way, I don't think we should try to attribute that as a people to COVID-19. I think that would be us as a people really using that as an excuse. Voting is one of the most important things that you can do as a citizen, both to represent you and your family and working Oklahomans. And so I encourage everyone, regardless of their view on State Question 802, to do whatever it takes in order to vote, and we'll see the results on June 30th.
All right. I'm sorry to say our time has run out for questions. We've set aside 90 seconds for each of you to make a quick closing comment, and by prior agreement, Mr. Blatt, you'll be going first.
Thank you, Jonathan, for saying when State Question 802 passes and not if State Question 802 passes. Oklahoma has wasted a decade where we have refused to expand coverage for 200,000 low-income Oklahomans. We have seen the state continue to have the second highest uninsured rate in the nation. We have seen Oklahomans' health continue to show up at the bottom of a plethora of health rankings, and we've continued to see hospitals in rural Oklahoma close and go into bankruptcy. Other states have expanded Medicaid. They've seen clear and measurable improvements in access to care, utilization of services, affordability of care, and financial security. We've also seen net benefits to their economy, to their state budgets. This really should be a no-brainer. We know that Oklahomans have been waiting far too long for this, are enthusiastic, as was shown by the over 300,000 who signed the petition to get Medicaid on the ballot. So I encourage all Oklahomans to apply for and fill out absentee ballots and to go to the polls on June 30th, so that finally those hardworking, low-income Oklahomans have a chance to get the health care that they need and deserve. Thank you.
Jonathan Small, you have 90 seconds.
I think it's very important that we continue to talk about how to address the needs of the most vulnerable. Unfortunately, State Question 802 is not the path. According to the Oklahoma Healthcare Authority, it will make 628,000 Oklahomans eligible for medical welfare, enshrined in the Constitution and put in front of the line of the aged, blind, disabled, and our most vulnerable, like women and children. That cost is $374 million a year in the state share cost. Some are positing that we should expect that few people will enroll in an automatic guaranteed welfare entitlement program, despite the fact that other states have seen significant enrollment. In states that have expanded Medicaid, they've also seen rural hospitals continue to close. In states that have expanded Medicaid, despite the promises from hospitals that it would lower uncompensated care, it didn't. They raised prices on their local payers and continue to expand rural hospitals or expand urban hospitals. We must focus on real reforms that empower patients, provide care to the truly needy, and also protect the taxpayers from the dangerous tax increases that are coming to working Oklahoma families if State Question 802 somehow passes.
Thank you. I want to thank our guest today, Jonathan Small, President of the Oklahoma Council of Public Affairs, and David Blatt, who teaches public policy in the Master of Public Administration program at the University of Oklahoma, Tulsa. You've helped us understand a difficult issue that voters need to understand fully. I also want to thank my friend Patty Mullen, a member of the League of Women Voters of Metropolitan Tulsa Board of Directors, who helped us stay organized today. Thank you too to our viewers and to our sponsor, the George Kaiser Family Foundation. Join us again next week for our next Tulsa World Let's Talk virtual town hall, which will feature Oklahoma State University President Burns Hargis and University of Oklahoma President Joe Harris, discussing the future of higher education in Oklahoma. I'm Wayne Green, editorial pages editor of the Tulsa World. Goodbye for now.